Bismillah ar-Rahman ar-Rahim. Our case today is very interesting. Full term baby, 39 weeks, admitted due to neonatal jaundice. Nursing staff reported to you the baby having abnormal movement. So, what are specific questions you would like to ask to reach to diagnosis? So, you have to assess the baby history, clinical examination, then put your professional diagnosis. Then you have to confirm your diagnosis by laboratory investigations or imaging study, and you have to consult the subspecialty. After that, you have to counsel the parents. So, what are specific questions we'd like to ask? There is 6 risk factor and 6 questions. You have to know the 6 risk factor before you go for the question. You have 6 risk factors. This is 3H, 3Is, and 3M. 3H, hypoxic ischemic encephalopathy, hemorrhage, and hypocalcemia, hypoglycemia. Almost hypoxic ischemic encephalopathy, 30 to 50% from the cases, and this is the most common cause of the abnormal movement. Intracranial hemorrhage, almost 10 to 17% from the cases. Hypocalcemia, 6 to 15% from the cases. Hypoglycemia, almost 6 to 10% from the cases. This is the 3H, hypoxic ischemic encephalopathy, and hemorrhage, and hypocalcemia, hypoglycemia. 3I, CNS infection, infarction, and important error of the metabolism. So CNS infection like meningitis, almost 5 to 14% of the cases. Infarction, 7% from the cases. Important error of metabolism, almost 3% from the cases. 3M, meningitis, malformation, metabolic disorder. CNS malformation, almost 5% from the cases. And as we know, the meningitis or infection, it almost 5 to 14% from the cases. And put in your mind, unknown cause, it will be 10% from the cases. So this is the 6 risk factor. 3H, hypoxic ischemic encephalopathy, hemorrhage, hypocalcemia, hypoglycemia. 3Is, CNS infection, infarction, important error of metabolism. And 3M, brain meningitis or malformation or metabolic. So the 6th question you have to ask to reach to diagnosis. The first one, you have to ask about gestational age. Baby full term or preterm. Full term, it's common subtle seizure. Preterm, it will be clonic seizure due to BVL. It will be later. And you have to ask about the birth weight, because small gestation age or symmetrical age is common and liable for such age group. And you have to ask about what? The third one, the blood sugar, because hypoglycemia. And you have to ask the 4th question, how old the baby. At birth, it's common due to maternal anesthesia. Can be present with apnea, asphyxia, seizure due to maternal anesthesia. This is the 4th question. The 5th question, you have to ask about family history. There is any consanguinity, قرايب ولا مش قرايب, عشان important error of metabolism. And you have to ask about also the genetic and inheritance. It will suggest good prognosis like what? Benign familial infantile seizure. And also you have to ask about the maternal history. 3D, maternal disease, maternal drugs, and database. Maternal disease, preeclampsia or diabetes, hypertension leading to placental insufficiency, and asphyxia leading to seizure or abnormal movement. And you have to ask about the medication the mother is received. Database, there is hiccups in utero during the pregnancy. It will give you clue about what? Non-ketotic hyperglycemia. Non-ketotic hyperglycemia. So the 6th risk factor, hypoxic ischemic encephalopathy, hemorrhage, and hypocalcemia, important error of metabolism, infection, infarction, and meningitis malformation, and meningitis.